and we'll come to our next speaker, our third speaker, Sonja Merten from Basel, actually very close to where some of us might be now physically. And she holds a PhD in epidemiology from the University of Basel and also a Master of Public Health. She has in the past worked for the WHO and the Swiss School of Public Health. And since 2009, she is responsible for the topic of society, gender, and health at the Swiss Tropical and Public Health Institute, where she's concerned with the equity in access to health services. Today, she will be speaking about a topic that we've already heard several times in the last two speeches, the COVID infodemic. I love that play on words, and how we're grappling with the crisis of trust. So, Sonja, I'll give it over to you.
Thank you very much, Miriam. I will speak about the role of misinformation, how this jeopardizes social cohesion from a bottom-up perspective. And so I would first like to give you a flavor of what you have, of course, probably also heard or seen in the past.
Intentionally using synthetic molecules, which by design are cancer, AIDS, all of the bogeymen we could dream up.
Yeah, it's for the purpose of sterilization and population control. There's too many people on the planet we need to get rid of. In the words of Bill Gates, at least 3 billion people need to die. So we'll just start off in Africa. We'll start doing our research there, and we'll eliminate most of the Africans because they're deplorable. They're worthless. They're not part of this world economy. So they have their rights taken away, and they're suppressed, and they're experimented. And
okay, so I received this video through WhatsApp from a businessman in Zambia. And actually, although, of course, he was very skeptical, I could also feel that he was worried somehow about this. Especially also that local churches shared similar stories. So people who have experienced racism, for example, they might just have very different sentiments to statements like this. So this infodemic does not only misinform people, it really stirs up their emotions. And if in such a situation, if then these rumors or these messages are debunked by newspaper articles and so on, this might then just not necessarily work from the perspective of the people who feel uncertain after they have heard all these stories. And actually, this is nothing new. When we think back at the for example, also in the US, there were a lot of rumors around the HIV agent being developed by CIA to kill African Americans and gay people. Heller in 2015, however, cautions us, saying adequately that there might be a rumor, but that people are worried about this, about such rumors, is not really based on, caused by distrust, by deep distrust that some of the rather marginalized or disadvantaged groups might have as regards. Sorry, I kind of have to click. Sorry. An alert away. It's combined with a high anxiety that people might have because they're already in a disadvantaged position, and the distrust they experience with authorities and politics in their context. Similar findings were made actually in during the Ebola outbreak. There also people were fearful that healthcare workers would be killing people, based also on a very long relationship of distrust in the government health system. again, in DRC, when Ebola broke out in the eastern region, then this was just at the time the elections were ahead, and then the entire region couldn't vote because of the Ebola crisis. And one of our collaborators, actually, from DRC, she was posing the question that she picked up the rumor that this can't be a coincidence that just now Ebola comes up, just now we have the vaccines, some people can vaccinate. Why is this now spreading here where it hasn't spread before? As it has been mentioned before, this goes further than distrust in the government. There is also a distrust in science as such, science as related to negative forces that are experienced as negative, as putting some people at a disadvantage, as for example in Zambia, where I also conducted research in the past, there were rumors about HIV research being linked to Satanism, and this went on basically for the past 20 years. Already 10 years ago, again, rumors about vaccines have been investigated backwards. So Amy Keller has put together all the articles that she found from the 1920s onwards, and it started basically in the Central African regions that there were rumors around sterility associated to vaccination. Then every 10 years, a couple more countries joined, or there was evidence coming up that rumors started to play a role in campaigns, and basically until today it spread across the entire continent. However, a very big difference to the past is that these rumors have been accelerated by social media in the past years. So in a couple of years back, it has been estimated that it takes very little, actually, very little time to spread a rumor across millions of people through, for example, Twitter. And that's also what has happened in the context of COVID-19. You can see here a map from an article from Islam and colleagues showing countries where rumors have been detected. The more red, the more rumors they identified through social media. Now the question is, how can we halt the spread of the rumors, and especially if there is a collective memory of powerlessness and exploitation in some areas of the world, if people have fears of extinction that are fed with these rumors, if there are past politicization processes of public health interventions in settings where family planning programs, for example, are extremely strong and felt to be imposed on the population, and also in areas where the disadvantaged are hit much more by the epidemic and the measures taken, the public health measures taken. For example, those with with no income generation, except in the informal sector. There are a couple of ways forward to try to re-establish trust through better communication. So it has been acknowledged widely by WHO and all multilateral organizations that trust is key and communication is needed to establish trust. But it's needed to understand the social, economic, political, and historical context. And also we need to understand how people perceive these crises and the measures that are taken. Often there is not a lot of information from the population getting back up to the government. So there is a need to establish really a dialogue with diverse groups in the population and to communicate in a very transparent way. And then in addition, the modes of communication also need to be considered carefully in order to re-establish or reinforce trust with the government health systems. Just a very brief note on a project that we are currently working on. That's the Publico experimental platform to understand the public perception of COVID-related issues. It's led by the University of Zurich, by a group of ethicists, and with us. And the idea here is to have a bidirectional interaction between the people and policymakers for crisis communication. So it's a participatory approach that should allow an ongoing dialogue through this platform. And you can see that it is a complex platform that includes data collection and data provision at the same time, so that people will also get information out that is tailored to their information needs. So the main questions here are: what are people's concerns and what are they looking for? What information do they actually have access to? And this should be a living analysis and flexible to allow back and forth communication. So there are other examples, of course, of projects that go in this direction, but it is clearly, from our perspective, very important to allow the population to be heard in this crisis. Thank you very much for your attention.